Hi everyone, and welcome to this first in a series of 4 webinars given by the EQUATOR Network and AH Editing. The series is How to Write Great Research Articles, and I'm Jennifer Beyer from the UK Equator Centre here at the University of Oxford. So in this first session, we're going to be talking about what makes a great journal article, and we're going to be introducing this fantastic tool called Reporting Guidelines. And if you join us later in the series, on the 21st of November, we're going to plan how to write a research article from scratch. On the 28th of November, we're going to be writing a rough draft, running through section by section how to write that first draft of your article. And on the 5th of December, we're going to be polishing your words. So we're going to be going through sentence by sentence, paragraph by paragraph, to polish your words to make it really simple and easy to understand. So are you ready to learn how to write fantastic health research articles? Let's get going. So today we're going to cover what makes a great journal article, because we can't write a great one unless we know what it is. And then we're going to talk about what reporting guidelines are, how to find the right one for you, and what international journals mean when they say, please submit a reporting guideline. If you've got any questions throughout the webinar, please just pop them in the comment box, in the question box as we go along. We've got a dedicated Q&A section at the end of the webinar. So first off, what makes a great journal article? To think about that, we need to take a step back and think about what goes into a journal article, which is our research, our fantastic research. And we all do research for very different reasons, but I think one overarching reason for doing research is we want research to change the world. We do research because we want somebody to use our research to do something that is changing how they think about the field that you're in, changing how they think about theory, or maybe as specific as changing how people's healthcare works to save lives. But research, usually we do research because we actually want something to happen with it. It's not just something that stays on our computer hidden away. We want our research to be used by somebody to do something. So have a little think and pop it in the comment box. Who might use your research specifically? Let's see if I can have a look at the comments as they're coming through. There we go, yes. So have a think, pop it in the comment box. There is no right or wrong answer here at all. It's who do you think might use your research? So nobody's commenting as yet. Right, so thinking a little bit about who might use research. It's people as easy as other researchers, right? We hope other researchers will use our work. We want them to use our methods in their future research. We want them to use our results to propose and generate new hypotheses for new studies. But we also want to see professionals, doctors, teachers, lawyers, changing how they work using our research. We want our research to change public policy when it's used by government, and up until the general public. Our research can be used by the general public to change their understanding of the world that they live in. But with all of these people, how are they interfacing with your research? It's with one thing, the journal article. In the vast majority of cases, no one is going to get to sit down with you and talk about your research to understand what you did, how you did it, and why it matters. Most people will sit with just a journal article. That is their entire communication with you about your research. And if you think about that, when they're sitting with that journal article, do they have everything they need to use your research? Or would they need you with them? What do users then actually need from an article? What do they need? I think it's 3 things. They need an article that they can read easily, that's not lost in very complicated language. They need something that they can read and understand, that they don't need to spend hours and hours and hours digging through your argument to understand what it is you're trying to say. And they need something that has enough detail that they can actually go out and use your research. They can plan that next study using your methods. They can implement that intervention with their patients without needing to contact you. And that starts to tell us what makes a great journal article. Something that's easily read is something that's simple. It's not using complicated, difficult language. Something that's easily understood is something that's clear. Our science is already complicated. We don't need to hide that argument in further complication. And something that has enough detail is complete. The journal article stands alone as a document. And for the rest of this session, we're going to focus on completeness. We'll come back to simple and clear later in the series, but for right now, we're going to focus on that one simple element of completeness, using this tool that I've mentioned, reporting guidelines. So before we even start further, I'm going to see whether I can manage to share a poll. No, I can't see it at all. Right, so into the comment box, please pop, had you heard about reporting guidelines before this webinar? And if you had you ever used them before? Oh no, a poll has been launched. You should see a poll.
Yeah, that was me, Jennifer. Sorry, I'll just do that if you need it.
Fantastic, thanks so much, Mike. So there's a poll sitting up on your computers. Have a quick think. Had you heard about reporting guidelines before this webinar? And if so, had you ever used them? We're going to give you a couple of moments because the organizer needs to close the poll again before we can move forward. Okay. Mike, can you share those results? Fantastic.
Yes,
so,
yes, indeed.
Okay, great.
You can see them up there now? Okay.
I can't see the results,
Okay.
but I can see that I'm on screen sharing again. Sorry?
Okay. 23% said yes, I've used them.
Fantastic.
32% said yes, but I've never used them.
Excellent.
45% said no, never heard of them.
This is amazing. So you are the audience that we would like to be speaking to. If you're using reporting guidelines already, that's amazing. Congratulations and keep going. If you've heard about them but you haven't figured out how to integrate them into your work, you're in the right place. We're going to talk about that right now. And if you've never heard about them before, thank you so much for joining us to learn about this amazing tool. So basically, reporting guidelines are just a reminder of the minimum information that your reader needs. It's literally just the detail that they will need to put your research into practice. And you might be thinking, but I know what a journal article looks like. I need an abstract, I need a title, I need a methods, but there's so much more to it than that. If we talk about methods, what do we actually mean? When I'm talking about different study designs, what do you actually need in there? This is what a reporting guideline looks like. This is the CONSORT guideline for randomized controlled trials. So there are guidelines for each specific study type. And CONSORT is the most well known because it was the first to be designed. And you can see under methods, we've got really, really detailed. Things like the trial design. Did you remember to tell us exactly what kind of trial? Things like the sample size. Did you remember to tell us exactly how you calculated that sample size? When you talk about the randomization, did you randomize? If you did, how did you do it? It's this level of detail that needs to be included in an article so that it can actually be used. Where these come from is by groups of multidisciplinary experts. Reporting guidelines are based on evidence. They tend to be developed when a group of experts who use a particular study design find that the papers that they are working with typically miss certain important details. And that's when a reporting guideline group gets put together, and this group of experts, so it will be people who are using research from very different fields, whether they are statisticians, whether they are primary researchers, whether they're systematic reviewers, coming together to figure out what is it that we need from these articles in this particular study design? What do we need to see reflected? And these reporting guidelines get developed through a consensus process based on this evidence. They usually get published in 2 papers. The first is a description of what the research, how the guideline was actually developed, and it gives the basic checklist. So this is STROBE, which is the big checklist for observational research. But a second paper also gets published. It's called the Explanation and Elaboration paper, the E&E document for short. And this is a fantastic learning tool because what it does is it goes through each item step by step and explains why that item was included in the checklist, so why people need it to best use your research, and gives an example of excellent reporting. So if you're ever using a reporting guideline and cannot figure out from the checklist what they're asking, go back to the E&E document. That's where all of that detail is sitting. And some of you might now be thinking, oh, I'm looking at that item up on the board. It says study design in the title or abstract. I wouldn't forget that. I definitely wouldn't forget that. The reality is this checklist alone has got something like 50 items in it. Now, if I go to the supermarket and I need to get 3 things, say bread, milk, eggs, if I walk into that supermarket, I will guaranteed walk out with 3 completely different things, or possibly a whole bunch more, and not have remembered my 3 things, unless I'm bringing my checklist, my shopping list, bread, milk, eggs, and you might be the same. And how much more important is your research than my shopping list, than what I need in my fridge? The reality is, writing up our research articles is challenging because we are so intimately involved in our research. After spending 1 to 5 years on a study, we're so embedded in it. It's quite challenging to remember what level of detail someone coming from outside needs. And that's where these checklists, these shopping lists for you, the very busy researcher, come in so handy. So why not use these fantastic shopping lists? It's a lot more detailed than my 3-item shopping list. And the great thing is we know that reporting guidelines work. There's been loads of studies that are essentially before and afters in particular fields, measuring the impact of a reporting guideline. And they show a slow but steady improvement in reporting after a guideline is released. But we also have what you see at the moment on the screen, 1 very small randomized controlled trials, which gave a group of students a writing exercise. And they were given either a reporting guideline prompt for particular items or they weren't. And you see there's a huge difference in particular items between whether they were given that writing tool or not. Having these prompts really does help us to remember every important detail to make sure we have a complete record in our journal article. And it's not just the EQUATOR Network that thinks these are a fantastic tool. Reporting guidelines are endorsed by journals, publishers, funders, editorial groups, research organizations, you name it, they like them. And here's just a few things that particular journals and publishers have said over the years and are saying in their author instructions right now about reporting guidelines. International journals want you to be using reporting guidelines. It ensures that the articles that they are publishing are complete records, which means they're way easier to peer review, and it means they're much more likely to be used and therefore cited. It's not just that. Reporting guidelines are part of an international effort, as Mike was mentioning, about improving the research literature and improving research in general. You've probably heard about the reproducibility crisis and about research waste. Reporting guidelines are 1 tool to help improve our literature, so the research of the future is based on a better evidence base. And by joining in, you are joining this international effort to make even better health research and even better research. So thank you for joining us. So, how do you find the right reporting guideline? There's 5 easy steps. The first, be certain of what you actually did. So, that might seem like it's fairly obvious, and I'm sure it is. Having a think through what kind of study you actually did. Did you do a quantitative study or a qualitative? Were you doing descriptive or analytical, experimental, observational? What kind of research were you doing? Are you working with human participants, animals, or with cells and microbes, in vitro, in vivo? You need to know exactly what you did before you can find the right reporting guideline. And just take a moment. You can write it in the comments or just write it down for yourself on a piece of paper. What kind of research study type are you working on right now? Or are you planning a journal article for? Write it down, because we're going to come back and we're going to solve your problem. Which reporting guideline should you use? So take a moment, write down what kind of study are you doing. The next step, and this is really important for any time you're writing anything for a journal, check the journal's author instructions. Why would you do that? Well, let's zoom back to the BMJ. This is their instructions for authors from last week. And you can see they have, for particular study designs, they've asked for particular reporting guidelines. So if you're doing an RCT, a randomized controlled trial, they're asking you to use CONSORT. If you're doing a systematic review, they're asking you to use PRISMA if it's a review of RCTs. They're asking you to use MOOSE if it's a systematic review of observational research. They're giving you which reporting guidelines they'd like you to use. But you can see this isn't an exhaustive list of every single kind of research study. And many journals won't give you this level of detail. They'll just say, use the right reporting guideline. Good luck, find it yourself. So if your journal doesn't suggest the right reporting guideline for you, or if your journal suggests reporting guidelines but doesn't get into enough detail for what you're happy with, next step is to find the general reporting guideline that you need. And for that, you need a collection of the reporting guidelines, which brings us to EQUATOR Network. So the EQUATOR Network has existed for about 10 years, and we're around to bring together all of the reporting guidelines on health research on human participants. We do branch out a little bit. We've got some animal preclinical research, but there are other databases out there on other kinds of research, which we can always point you towards if you're looking for different kinds of reporting guidelines. We focus on the human participant research. The reason that we're doing this is, as I've mentioned, the research of the future can only be as good as the research it's based on, as the journal articles it's based on. The methods that you're using in your research are pulled out of journal articles. Your hypotheses are generated using the research that already exists. So by promoting guidelines, we're improving the publications now to improve the quality of future research. And this is the global initiative that you're becoming a part of right now. So on our homepage, we have a collection of the general reporting guidelines for the big study types. So say you were saying, oh, I'm using qualitative research. There's a reporting guideline, SRQR. Maybe you're doing a case report, a descriptive research. You need CARE. Maybe you're doing clinical practice guidelines. You need AGREE or WRITE. And each of those links will take you to that reporting guideline and a downloadable checklist where it's available. But say you're doing an RCT, a randomized controlled trial, and you're thinking, there are a lot of different kinds of randomized controlled trials. One checklist can't cover them all. And you're right. These checklists give minimum information, but they could be expanded. And that's where extensions come in. So for example, with the RCTs, you can see here a list of some of the extensions for CONSORT that have been created. So there's an extension of CONSORT for livestock trials. So it's using the principles for human research, but using it on livestock trials, and that's REFLECT. There's also extensions for things like within-person trials or for non-pharmacological trials. So there are extensions. They're essentially the CONSORT guideline with a little bit of extra under certain of the items. So you can still use CONSORT, you'd be absolutely fine, but using the extension does help give you that little bit more extra detail. So where do you find them? Back on the home page. There's a link that says see all reporting guidelines. If you click on it, it will give you a search box. You can search our database of reporting guidelines by clinical area, section of report, study type. So for example, here I'm searching by clinical area. I'm searching public health, and I can see 7 reporting guidelines, one of which is highlighted in green. So the reporting guidelines highlighted in green are the extensions of those big general reporting guidelines. You can see here, there is an extension of STROBE, which is the reporting guideline for observational research. It's an extension for public health specifically, for molecular epidemiology. So there is one available. If you were doing another kind of public health research, say an RCT, you would then be sticking with general CONSORT because there isn't an extension specifically for public health. Finally, you may be thinking 385 guidelines. Those can't be all extensions, and they're not. There is a lot of add-on guidelines. There you will be focusing in on maybe very specific sections of a report or very specific clinical areas where a group of experts has noticed there's a deficiency in a particular area. And these get used in conjunction with, alongside, the general reporting guidelines. So you can see here I've highlighted searching for statistical methods, and I get the sample guideline. So these are great when you are working on a field for the first time, or if you're looking for a little bit of extra information on how to report. So for instance, sample lists every kind of statistical analysis you can think of and takes you through how you should report it to make your statistical reviewer really happy with you. Everyone will understand your stats. So these are good dip in and out reporting guidelines. And here's just a suggestion of some of the common ones that people find useful. Things like cherries for if you're doing an internet survey. Things like tidier, which is useful for anyone reporting a particular intervention to make sure that people can actually implement them. But don't feel overwhelmed. Sticking with the big general reporting guideline for your study area is enough. That is enough to give you a coherent, complete report. So don't feel overwhelmed. You're completely fine just sticking with those off the homepage, those big reporting guidelines. So you wrote down which type of study you were using. Which one of those reporting guidelines is going to work for you? Are you going to be a consort person? Are you going to be a stroke person? Yeah, so write it down. If you want to pop it in the comment box, you're welcome. But otherwise, write it down on a piece of paper so you know for yourself. After this webinar, you can go out and download that checklist and start using it. So now that you've found the right reporting guideline, next up, what do you actually have to do with it? And I've mentioned journals a lot. What do journals mean when they say, use a reporting guideline and hand it in? This is all they mean. They literally mean, take the reporting guideline, take your final article and go through it line by line, item by item, and state to them on which line number, on which page number you have reported each item. Very straightforward, very easy. But what if you get to an item and you realize, oh no, I never considered it in my study design? It's okay, don't stress. This is absolutely fine. You do not need to have considered every single one of those items or done every one of those items. Essentially, these items are talking about if you had a user and that user is thinking about this kind of study design, these are the pieces of information that they will need and they will be thinking about. So if you didn't say blind your participants, that's fine. But your reader needs to know that you didn't, and they need to know why you didn't, if you can explain that. So all you need to do is just say exactly what you did and why, and then everybody's happy. But this does suggest that there's maybe some areas where you could use reporting guidelines a little earlier in the process. So for example, when you're planning your research study, you could use that reporting guideline to suggest which elements for a particular kind of study you should consider. You can also use them to plan your research article, what sections you need. You can use it to write your article so that you don't forget any details. You don't have to go back and add them in when you've got a final draft. And we're going to be talking about all of these elements later in the series. So today, we've done an introduction on reporting guidelines, but on the 21st of November, we'll be going into more detail. How do you plan your research article? How do you think about things like your audience, the message that you want to bring across? How do you choose the right journal for you? And all of that will bring you back to reporting guidelines and creating a complete and clear article. Then once we've planned our article, on the 28th of November, we're going to be writing a rough draft. We're going to be running through each of the big sections in a journal article, so we've got a logical, clear structure, and we're going to be running through how you can use a reporting guideline to manage that. We'll also be talking about a logical order for writing. And on the 5th of December, we're going to be polishing our words. So you've written that rough draft, you've not looked at it, you've just written it. How do you go through and craft each sentence so it's as simple and clear as it can possibly be? And at the end of the series, we hope that you're going to be confident writing articles that are as simple as possible, as clear as possible, while still being as complete as they need to be, so that they can be used, so they can be read, understood, and most crucially used. So, are there any questions? Please pop them in the comment box. Let's see if there's anything in the questions. Oh, yes, we have a question. So, is there a reporting guideline for case studies? Yes, there is. That would be CARE, so C-A-R-E, and that's on our homepage. So, on EQUATORnetwork.org, you can find CARE. That's for case studies. Great question. Second question, Will journals help me use reporting guidelines? Yes. So the journals in the instructions to authors are going to suggest the reporting guidelines that they would like you to use. How to use them, they don't tend not to go into the specifics, but we're going to be talking a lot about how you can use reporting guidelines at each stage. Some journals are even suggesting now that their peer reviewers use reporting guidelines to help guide their peer review. So it's another place where you can use reporting guidelines. And I think there's one more question. How do you report if you've used a reporting guideline? Fantastic question. So in your methods section, if at all possible, the final line of your methods section should be, this article was reported using Consort, and then give the link to that first paper that we talked about. So remember, there's two papers. There's that first big checklist paper, and the second paper is the E&E. So you want to cite the first paper. So that's how you report that you've used a reporting guideline. And for the journal's purposes, they will usually ask you to upload 2 documents when you're uploading your article. You submit your journal article, your draft, as well as that completed checklist. So I think that's all of the questions. Thank you for sending questions. That's really great. And oh dear, we hope that you found this really useful and that you're going to join us next time where we're going to talk about planning to write. So Mike, back over to you.
Okay, thanks very much, Jen. Just to reiterate something that Jen said before, the next webinar will be on the 21st of this month, and we'll endeavor to get the invitations out a little bit earlier this time around, and I'm sure you're all looking forward to it, and we'll be going in much more detail as we go along. And thank you very much for being here today, and we'll look forward to hosting you again next time. Thank you.